Hello, everybody. Good afternoon, and thank you for joining the American Parkinson Disease Association for this episode of Thriving Through Speech Therapy. I am so excited to welcome our speakers, Corinne Casey and Anna Reeve, to share their presentation with us today. Corinne is a speech language pathologist based in Cleveland, Ohio. She graduated from the University of Akron with a specialization in augmentative and alternative communication and joined Graphica in 2025. And prior to joining Graphica, Corinne served a diverse patient population across acute care and outpatient settings. She's passionate about supporting individuals with Parkinson's disease and is a certified Speak Out provider with a deep commitment to helping individuals with communication disorders stay connected to the people and moments that matter most. Anna Reeve is a speech pathologist with over 17 years of experience supporting adults with communication and swallowing needs. Since earning her MS in speech language pathology from Idaho State University in 2008, she has worked across outpatient, inpatient, home health, and skilled nursing settings with extensive experience serving adults with neurogenic conditions. Anna has a strong passion for AAC and empowering individuals to communicate more independently, which she brings to her current role at Graphica. She is also deeply committed to supporting veterans and the clinicians who work with them. Corinne and Anna, thank you so much for being here, and I'll turn it over to you.
Thank you. We're so excited to be joining you for the third webinar in this series. We want to thank the American Parkinson's Disease Association for having us. And today we'll be sharing information about how to stay connected by overcoming communication barriers. Oops. So you can see here, I am a manager of clinical relationships at Graphica, as well as an SLP.
And I am Corinne. I am a clinical consultant with Graphica and a speech language pathologist as well. So a quick financial disclosure. Anna and I, as we both stated, are employees of Graphica, and thereby we receive financial compensation from the company. In today's presentation, we are going to review communication changes and the importance of communication changes. And the importance of communication. We'll provide practical tips for improved communication in daily life. We'll discuss technology and assistive devices. And lastly, we'll explore how family and friends can help. So let's begin by talking more about communication and Parkinson's. In this section, we'll talk about why communication matters and briefly review some anticipated communication changes that are often seen in the setting of Parkinson's disease. To define communication, at its simplest, it's an exchange of information. Most commonly, communication is thought as being synonymous with verbal speech, a transfer of words to convey information. However, communication as a whole is much more broad, and it encompasses many factors: setting, tone of voice, context, facial expressions, memories, gestures, so much more. So as we continue through this presentation, I encourage you to remain thoughtful about this broader sense of the word communication. When we think about this broader definition of communication, exchanging information through tone of voice, facial expressions, memories, gestures, the understanding of why Parkinson's so significantly impacts communication becomes more clear. So yes, communication changes are very common with Parkinson's and also very manageable with daily use and practice of communication strategies. So now that we're thinking about communication in this broader sense, not just as speech, but as expression, understanding, cognition, connection, we can start to see how Parkinson's can affect multiple parts of the system at the same time. Many people first notice changes in expression. Speech may become softer, hoarse, or breathy. Words might come out in short bursts, sound slurred, or be harder to find. Facial expression and body language may also decrease, which means that even nonverbal communication can change. But communication is also influenced by cognition, how we think and process information. Parkinson's can affect attention, memory, and problem solving. Changes in mood, energy, or fatigue can also make it harder to participate in conversation. And finally, there is reception, or how communication is perceived and understood. Some individuals have more difficulty understanding others, especially in complex or noisy environments. There can also be changes in sensory feedback, which is how we monitor the speech that we produce ourselves. And so, for example, someone may feel like they're speaking really loudly, even feeling like they're yelling, when their voice is actually quite soft. So, when communication breakdowns occur with Parkinson's, it's rarely just one factor. It's usually an interaction between expression, cognition, and reception. So when we understand which parts of communication are being affected, we can begin to put the right strategies in place to support more clearer and confident communication. When communication becomes more difficult, it can begin to affect independence and daily functioning, from managing appointments to participating in conversations at home or in the community. Over time, these changes can also impact a person's sense of self and identity. Communication is how we share our personality, our opinions, our humor, and our values. And when expressing those things become harder, it can often feel like losing a part of yourself. And perhaps most significantly, communication breakdowns can lead to feelings of isolation. When conversations take more effort, some people begin to withdraw, and others may unintentionally start to speak for them. Connection becomes strained, even when the desire to connect is still very strong. And this is why addressing communication in Parkinson's is so important. It's not just about volume or clarity. It's about preserving independence, identity, and meaningful relationships. So I've said a couple of times this term communication breakdown, and let's define what that means. So a communication breakdown occurs when there's a disruption in the exchange of information. When a message expressed is not understood by the other person in the conversation. When a communication breakdown occurs repeatedly, they affect more than just the conversation itself. As we previously discussed, this can impact emotional well-being, interfere with daily activities, and place strain on relationships. So let's talk about some examples of those communication breakdowns. And you may be familiar with some of these signs. We'll call this guy here John, and he's feeling a lot of frustration. He's having difficulty following conversation, and he's noticing that he's not being understood. People are asking him to repeat himself a lot. John's family and friends, they're starting to notice that he's using more filler words. He's maybe looking confused at times, and they're noticing him repeating words a lot. But because John and his family members are noticing these things, they're identifying when these breakdowns are happening. And this is going to allow John and his caregivers to intervene early. Recognizing these early signs of a breakdown helps you adapt communication strategies so that you can more quickly avoid any further frustration. All right, I'll turn it over now to Anna, who's going to talk more about how communication can be improved through daily life.
Yeah, so I just want to talk a little bit about some practical tips that you might use to think about this in terms of your day-to-day. So Sorry about that. So first off, I want to talk a little bit about communication ramps. We've all seen accessibility ramps for people with physical disabilities, and what they do is allow access, right, to public spaces, the home. And so I like to use this graphic to kind of show there are such things as communication ramps as well. So thinking about it in a similar way, how do we get this individual or for everyone to be able to have a role and have access? So thinking about support and how that can lead to success for communication challenges. There's so much that we can do to make communication easier. And you'll see throughout this presentation that we're going to talk about this as a group effort. This isn't just something that you, as someone with Parkinson's disease, are dealing with alone. It certainly is things that everyone can do to make this more possible. So thinking also about these ramps, you can see this diagram. It's not just one thing you're doing. You're going to be doing several things that allow you to be more successful and communicate with more ease. It's also about finding the right amount of support and not too much or too little. So there might be some individuals who have just a few things at first that provide that ramp for them to communicate more easily. Other individuals might have a lot, as you see here. So just some ideas, entering that conversation with a positive frame of mind, maybe using short or simple sentences. That could be from the communication partner for someone who has difficulty understanding, or it could be for the person with Parkinson's disease who actually can, communicate a little bit more clearly with shorter or more simplified sentences. There's also a lot of other things you can do, like simple drawings, providing picture choices, word choices, and even just having time in between to rest. So thinking about all of these things, your communication ramp is going to look different from other people's. And thinking about this is a conversation, this is something that will change perhaps over time, but also it's ultimately up to us to ask the individual what helps them. So we have to have these conversations about what are your strategies, what supports do you need, what's your ramp look like? So tips for communication breakdowns. So Corinne talked about what communication breakdowns are. And we're going to go through and talk a little bit more about general tips that work. So as I said before, communication is a team sport. You are not alone in this, and it really is going to be something that you and your communication partners, family, friends, whoever you're communicating with are going to do together. Sometimes it's helpful to have a written copy of what those strategies or communication ramps are to share with others. So if you have difficulty communicating, it makes sense to not have to say that to every single individual of what they can do to help. Sharing that information to friends and family could be really helpful so they can prepare on how to support you. We've all interacted with somebody who wants to support a ton, and maybe they're interrupting, maybe they're giving too much help, and that can be frustrating in itself. None of us communicate our best when we are experiencing frustration. So really advocate for what you can do. This is about getting the right level of support and making sure you can be as independent as possible. And we'll talk a little bit more about how friends and family can help later. It's also important to note that mistakes are going to happen. Communication breakdowns are expected when you have a communication challenge, whether it's from Parkinson's or something else. So just note that every mistake is an opportunity to learn what works for you for the future. And it is really important to prepare and kind of plan ahead. So when we're talking about how speech therapy can help, really working with your therapist to determine what your specific strategies are, how to communicate those out to people. And then if it's not going well, maybe you have some strategies in place and they're just not working the way they used to, and maybe you need to revise that plan, a speech therapist can be super helpful too. Keeping in mind that anytime you make these plans and you kind of prep for what might be your good backup communication plan, you might benefit from practicing or role playing not in that exact environment. So thinking about how you can kind of practice these skills outside of any communication pressure that you would maybe have in certain situations or environments. And then, of course, As I said before, communication breakdowns can be more frequent when you're tired, when you're fatigued, if you're having a rough day. So take breaks and rest when possible, because that will help you to kind of address these in a better way. We do have some resources that we want to share with you if you haven't seen something like this before. This woman is wearing a personal voice amplifier, and this might be something that somebody with Parkinson's disease could really benefit from. A lot of people are just not loud enough, and certain times of day, this might fluctuate. So a voice amplifier is a real nice way for you to boost your voice and reduce those breakdowns if you're feeling like you can't be successful with just increased effort or strategies. So this is one thing just to highlight. We also wanted to share with you the American Parkinson's Disease Association printable medical cards. So you can download these as well. Sometimes it's just helpful to explain why you're having difficulty communicating. Not everyone knows what Parkinson's is, or would expect the communication problems. So if you can share something that's written, it can be really helpful in educating your community, as well as having them understand that you just might need a little bit more time. The company that Corinne and I both work for is a AAC device company. So it's called Lingraphica. And so we do want to note that AAC can be really helpful for people who have, um, kind of a gap between what they want to be able to say and what they are able to say. So there's different ways of communicating. And so AAC stands for Augmentative and Alternative Communication. So on the right, excuse me, on the left here, you'll see some low-tech options. You might handwrite, you might communicate in different ways, pointing to pictures or to a communication board. So those are some ways that people might communicate at different times of their day to be more successful. And then on the right, you see high-tech AAC options. So you'll see a Lingraphica device as well as Lingraphica apps. There's lots of options out there. We live in a very technology-heavy world. So keep in mind that there are things that can help you to communicate when you are having trouble speaking verbally. The thing to keep in mind with high tech is they do have voice output. So this makes it easier. When you push that button, it's going to speak out loud. So it might be easier to answer or talk on the phone, get someone's attention, talk to somebody from across the room. And you might use different tools for different scenarios. So it's not to say that you only use one or the other. You might have a combination of these things to help you throughout your day. Sorry about that. All right. And then we also have some uh, communication tools that might help you. So if you are interested in some free resources that we do offer, there is a ebook on navigating communication challenges in Parkinson's that you can download for free. We also have Join in Parkinson's groups. So these are social meetup groups that meet online over Zoom. They're free sessions, and you can meet with other people with Parkinson's disease and share about a variety of topics, including practice those communication skills. There's also a communication ID card that we offer, as well as downloadable low-tech communication boards. So please do check those out. All right, let's talk a little bit more about some common barriers that you might run into and how you can overcome them. So the first challenge we'll talk about is just speech clarity, and you might see some familiar strategies on screen if you have been to speech therapy before. And these things are things that, you can practice and might help you navigate those motor speech challenges that come with Parkinson's disease. If you attended the first session in this series, you received a lot of information on this. So if you haven't, we really encourage you to watch the recording on the APDA website. Also note that an SLP can help you find the right strategies for you. And if you are using some of these strategies and you're seeing some more communication challenges, just know that returning for a little tune-up is always expected. So keep in mind that sometimes we might need to revisit the strategies that you're using. So, as review, when you're living with Parkinson's disease, your brain makes less dopamine than it used to. So, that dopamine helps your body do things automatically, things like swinging your arms when you walk or speaking without having to think about every little movement or how loud you are. So, when dopamine levels drop, those automatic parts of speech can be affected too. Here's the encouraging part. The system that your brain uses for intentional movement, when you think to do specific movements, it doesn't rely on dopamine the same way. So that means you can bring a little bit more purpose and attention to how you speak. You can often make your voice clearer and easier for others to understand. So it can be as simple as slowing down a little bit, taking a fuller breath before you start talking, and just really being a little bit more deliberate with how you move your mouth or how loud you are. So it does mean that you're thinking about this process a little bit more, but those small shifts can make a real difference in whether or not you're understood. Thinking things like speaking a little bit louder on purpose, pausing between your thoughts, or exaggerating your articulation are ways that you can add more intention and more clarity to your speech. So even though there's small changes, your voice and your speech might sound a lot different. It's also very common for people to need more reminders and different strategies over time. So it's important to regularly check in on what strategies you use and the effectiveness of what you're seeing in your day to day. Another challenge that we see is with downtimes. Oops. So keeping in mind that between medication times or busy days, fatigue, illness, or even a progression of your symptoms with Parkinson's, you might notice moments where talking is more difficult. So keep in mind that that's typical and that's something to kind of expect. And when you're prepared for that, you kind of know that, okay, certain times a day I'm going to be able to speak clearly and I can use my strategies. And other times I'm going to need other tools. So that's when writing, gestures, pictures or drawings, and voice amplifiers, or maybe speech to text apps, or even a dedicated communication device might come in. So keeping in mind, we really encourage people that the more tools that you have in your toolbox, the better. So we really encourage that all communication forms are valid, use what works right now, and be comfortable with pulling different tools out of that toolbox when you need them. You're certainly going to be using different tools for different moments. The next challenge to kind of keep in mind is that learning new strategies and building new habits, especially with something that we do every single day, like talking, can be really hard. So that's true for all of us, that it's hard to learn new habits, but having a small and consistent plan, even just for a few minutes a day, can make a big difference. So focus on progress and not perfection. Celebrate the moments that things do work versus those where you struggle. We're suggesting that you kind of carve out daily practice each day that's routine at the same time, maybe thinking about reading aloud, using your strategies, maybe doing some singing if you enjoy that, or exercises that you've been assigned from your speech therapist, and pairing those speech practices with other daily habits that you're doing, right? So if you always have coffee in the morning, that's going to be a great time. If you don't drink coffee, that will not be a great time. Thinking about, maybe commercial breaks, maybe you watch favorite shows in the evenings with your family members, having those little check-ins or that practice time between in commercial breaks and using those strategies might be a good intentional time to focus on those strategies. Or, for example, maybe answering the phone. So, thinking about specific times of the day which you can focus on these new strategies and then slowly incorporating them into every day and every communication. It's also really helpful to have, check-ins with your communication partners. So, your family and friends, they're communicating with you the most. So having little check-ins to say, are you hearing me okay? Do you hear me using these strategies that I'm trying to use? Get some feedback and see when you're doing a great job, when you need more reminders. It can also help to have an accountability buddy. I know that this is true for me with things like exercising and other things that I should do, kind of tracking uh, which days you're doing those things and which days you're not. That can really help maybe in a journal. So, noticing those small changes, right? So maybe you forget some days, but last week you did it, 3 days in a row during this specific time, and then the next week you did it five. So that's just again, celebrating the moments where you're getting those wins, and that's going to be motivating. Another challenge that we see a lot is isolation. So, people with Parkinson's disease can feel really isolated. They're experiencing a lot of changes in their communication, in their daily life, and that reduced, dopamine also has impacts. So, staying connected can sometimes take some effort, but it's one of the most positive and most powerful things you can do for your own well-being. Connection is going to boost your mood, support your brain health, and give you real motivation to keep practicing those communication strategies you're learning, right? So if you're around other people, you're going to be forced to be practicing those communication strategies. So, staying engaged, even when life feels uncertain, is going to be helpful. It's going to boost cognitive function through that social interaction. You'll get natural practice versus practicing alone. That's not very motivating. It can also reduce stress and anxiety, especially if you are, joining with individuals who understand what you're going through. So maybe, a support group may not seem like something that you're interested in, but we really encourage people to do that because when you're around people who are experiencing what you are, it's automatically more comfortable. You can learn from each other, and it's going to be a way for you to feel supported emotionally as well. New conversations, are also really cognitively stimulating. So, really just encourage you to kind of combat this with kind of making an effort to stay connected and in community with others. And this isn't just for people with Parkinson's disease, but also their caregivers. They need that time to talk with other people, to share their experiences, and to feel supported. So there are lots of resources out there and lots of organizations who offer different options. So it's okay if one of these isn't a good fit for you, but hopefully you can try starting with one. The Speak Out home practice sessions are really helpful with the Parkinson's Voice Project, so you could join those from home. As I said, Ling Graphica has a virtual community for Parkinson's called Join in Parkinson's. Those are free. You just have to register in advance, and there's lots of good sessions for you to join. The Michael J. Fox Foundation also has a Parkinson's Buddy Network that you can look into. And then, of course, in your own local community, there's going to be support groups or senior activities. But the main thing is just to, stay involved in whatever social activities you are used to doing. So maintaining those things, and then maybe getting a couple where you feel supported in this journey that you're on with Parkinson's. You can always engage in small talk wherever you go, so lots of speech and communication practice there. And then more uniquely, there are different organizations that also offer what's called a Parkinson's ambassador. So you can work speaking at local support groups, volunteering for peer support, and educating different communities about Parkinson's. So if you're really motivated, that might be a great option. As Corinne said, cognition kind of comes into play here as well. So if you're noticing cognitive changes, difficulties with thinking, memory, or attention, this is something that's really important to talk to your doctor about because it can happen at different times in the disease process. So talk to them about that. They can diagnose and make referrals as appropriate, which might be to see a speech therapist. They can also provide medications that might be helpful to kind of reduce those symptoms or maintain what you have currently. And then just kind of keeping in mind that if you're noticing some safety considerations, memory type things or judgment, those kind of conversations are also really important to have with your doctor. A speech therapist is going to help as well, so they can identify strengths and weaknesses that they note in you. So it might look like an evaluation or more just, asking you questions about how things are going at home, chatting with your caregivers. But the main thing is that they can teach you cognitive strategies and support ways that you can kind of mitigate these changes and reduce their impact on your day-to-day life. They also can provide suggestions for stimulation and structure to your routines so that you can be more successful. Our goal is always to improve people's independence and maintain whatever they can do. So we're definitely on your side here. And so please do reach out if you have questions about that. Other things that you can do is reducing stress and cognitive load. Those things can really impact your memory and your attention if you have just a lot on your mind or you're dealing with a lot of stress. Focusing on activities that you really value and want to do. I think this is an important conversation. Sometimes people really feel strongly about continuing to do specific activities, and others, they would be fine if somebody else did them. So having those conversations with your family members can help you to reduce stress and errors if it's not something that you feel passionate about. And it's also really important to have these open conversations with your team. It can help you kind of build insight and awareness as to what other people are seeing or what's possible, what your options are. So definitely don't shy away from this conversation as it's something many people struggle with. As far as cognitive tips, know that there's lots of things that we can do. So similar to those communications ramps, we're going to look at, what support does this individual need? They're not meant to just take over for somebody. They're meant to support you so you can continue to do what you are able to do with success. So sometimes that might be verbal or visual reminders, increased care and support, maybe looking at additional caregivers in the home, or maybe just tracking changes. I have had clients in the past that really had mild problems and it really bothered them. So just making sure you have that conversation with your doctor or your therapist so you can kind of track changes as needed, as well as some counseling. Sometimes this can really hit people really hard. And so just kind of understanding the process and how this works can be really helpful, as well as strategies to kind of cope with those changes. There's lots of external aids that people might use when they have cognitive difficulties. So smart devices that remind them. I'm sorry, I forgot to advance my slide here. There you go. Smart devices that might remind them. And I said people with cognitive challenges. I would say just busy people in general. I use smart devices all the time in my home. I set reminders at work too. So keep in mind there's lots of strategies you can do. Written and visual aids, even talking medication boxes that might remind you of when to take your medications. And then this isn't really an external aid, but kind of wanted to make a note here of hearing aids are super important. So if you wear hearing aids, it's really important to note that it's important for you to consistently wear them. There's been research that's shown that people who have hearing loss are at increased risk for cognitive changes as they age. So just that like ambient noise and stimulation that we're constantly getting, a lot of people with hearing loss aren't getting that if they're not wearing their hearing aids. So really important to wear those. It can improve cognitive function and certainly improve communication. So keep those things in mind. You might also talk with your doctor about medical and lifestyle changes, whether that's medication, exercise, diet, addressing any sleep or depression issues. Sometimes people might be depressed and it kind of appears like a cognitive challenge. Sometimes when we treat, not we, but when medical doctors treat the depression, sometimes we see that their memory and their attention improves. So there's other things that can kind of mask and look like cognitive deficits that truly are other problems. They just have shared symptoms. So a lot of these things can really help. I do want to note that there's lots of resources out there on this subject as well. So this is just a few things to share with you. Um, I really am a big fan of self-reported scales. So a lot of physicians, a lot of therapists will use these, we call them patient-reported outcome measures. Really just thinking about specific questions and rating yourself on how you're doing with specific areas. So here's just one example for people with Parkinson's disease, and you can see that it can be a self-rating form or someone near them could fill this out. So just tracking those changes is really important. But it also sometimes we just don't think of every question to ask. And you might read through one of these self-rating forms and go, I really do have a hard time with um, organization or something like that. So something that it kind of calls out and draws your attention to. So these things can be really helpful as well. And then there's other, resources that you might find just some reading on um, different cognitive changes that might happen in Parkinson's disease. We also would just really advocate for having a routine and kind of thinking about what those routines are, maybe providing some written aids that are out and about to show what the routines are so you're not relying on your memory to recall those. So lots of things that you can do here. So having that laid out step by step can really help the day go smoother and reduce stress for you. And with that, I'm going to pass things over to Corinne, who can walk us through the next section on how friends and family can support. Oops, Corinne.
There we go. So if you are a family member or a friend, listen up. This is for you. I want to start just by acknowledging that we are very much so aware that communication changes affect you deeply as well. This is an adjustment for everybody, and it's okay to recognize that it takes time, practice, and a lot of compassion on both sides. Even though communication may look different, that connection is still very much so possible. And you, as family and friends, play a really powerful role in that. Okay, so Anna's mentioned this a couple of times, and I'm going to reiterate it. Communication is a team sport. It is not solely the responsibility of the person with Parkinson's to fix their speech. When both people make small shifts, conversation becomes a lot less stressful and a lot more successful. Staying involved really matters. Reassuring your loved one that you're there to help, not to rush them, can immediately reduce anxiety. It's okay to ask, do you want me to help? And then afterwards ask, was that helpful or too much? Remember, Anna was talking earlier about finding the right level of assistance. And this kind of check-in from you as the family and friend is really helpful in making sure that you're providing the right amount of support. And it also keeps a lot of dignity, respect, and independence for that communication exchange. Simple changes like turning down background noise, sitting face to face, offering yes or no choices when someone is stuck can ease frustration for you both. And if you don't understand something, it is okay to say so. Say so gently, though. Pretending to understand often leads to more isolation later. When both parties work together and make small adjustments, communication becomes a lot easier. One thing that we often talk with families about is how to encourage communication without accidentally adding pressure. This is really hard. When someone is working harder to get their message out, it is very natural to want to help, to jump in, to correct, to help move that conversation along. Most of the time, this instinct comes from a really good place, a place of love and care. But in practice, slowing down, creating space, giving a little more time is often more helpful. Extra time, a bit of patience with pauses, and offering choices instead of open-ended questions can make communication feel more manageable. It also really helps to acknowledge the effort that someone is putting in. Progress happens in small steps, and noticing these changes can build confidence over time. And this is a tip for the person with Parkinson's and the family members that are working to support them. Be specific when you're offering that feedback. Hey, I really liked the way you supported me there. Or, hey, I heard you use those clear speech strategies. That really helped me understand you. Now, for family and friends, your own tone and pacing really matters too. When you keep the conversation feeling calm and unhurried, it tends to make communication easier for everybody involved. And sometimes gentle cues can help too. A simple reminder like, hey, take a breath, or can you try that again? As long as they're supportive and not rushed. What we're really aiming here is not perfect speech. It is communication that feels successful enough that everybody involved wants to keep participating with. As communication becomes more effortful, structure can actually reduce stress. One helpful strategy is identifying good times of the day for longer conversations or social activities. Many people with Parkinson's notice their energy and clarity fluctuate. So planning those important discussions and social exercises during stronger times can make a big difference. Using visual reminders can also help. This might be a written schedule, a checklist, or encouraging use of communication boards, something that reinforces routines and reduces cognitive load. It's also helpful to agree on simple signals ahead of time. For example, maybe a hand gesture that means I need a break, and another hand gesture that means please repeat that. Having a shared signal prevents frustration and keeps communication respectful. And finally, being intentional about staying socially active. It can be really tempting to withdraw when communication feels hard, but connection is critical. And you, as family and friends, may need to step in to help keep these social activities happening. Even short, structured interactions can help maintain confidence and relationships. Routines don't make communication rigid, but they do make them more predictable and less overwhelming. I want to wrap up this section with an important reminder. With Parkinson's, communication changes happen gradually over time, which is why recognizing them early matters. Early support helps maintain communication skills, reduces frustrations, and lowers the risks of withdrawing from conversations or social activities. We want to take a proactive approach, responding to small communication changes early instead of waiting until they become a problem leads to better outcomes in the long term. And as family and friends, you play a really critical role here. Many times, it's the people around someone that notice the first subtle changes, like a slightly softer voice, more difficulty finding words, or conversation just feeling more effortful. It's really important that you bring those observations to the attention of the person with Parkinson's and to their medical providers so that you can put strategies and support in place right away. And you don't have to navigate this stuff alone. There are a lot of professionals who can help guide you. There are a lot of support groups available for family and friends of those with Parkinson's. You just want to keep connected and supported as you're navigating this process. And I cannot understate this, be proactive. As we close this presentation, I want to leave you with a few simple takeaways. First, small daily practice really does matter. You don't need long practice sessions. Just a few minutes here and there in your everyday conversations can make a big difference over time. Try to practice during real moments, things like chatting over coffee, making a phone call, or talking with family. Those are the situations that matter most, and this is where practice will be the most impactful. And remember, progress does not have to be perfect. Communication isn't about getting every word exactly right. What matters is the effort and the wanting to stay a part of the conversation. It helps to remember that communication works when it is a team effort. Supporting each other and being patient with each other goes a long way. If at any point you feel like you need more support, do not hesitate to ask your provider for a referral. And again, don't wait until there is a problem. Be proactive in your approach. Parkinson's may change how communication looks, but it doesn't mean that you'll lose the ability to connect with the people around you when you have the right supports in place. With that, we'll conclude our presentation and invite any questions you may have.
Thank you so much, Corinne and Anna, for that empowering and helpful information. We have questions from our audience, and the first question that I want to bring forward is a person with Parkinson's who has asked, what about when the care partner can't wait for you to find the correct word or take time to take a deep breath or asking for a pause? The care partner jumps in with their thoughts and, they're asking, what are you trying to say? They feel like the care partner can't wait for them to pause and find the correct words. What advice do you have for how the person with Parkinson's can approach that conversation with their care partner?
I just want to say that that's very common and it's very well-meaning a lot of the time. We see that, in our therapy offices, of course, we're oftentimes working with family members and their loved ones, and they're really trying to help. And I usually just acknowledge that intent. I'll say, like, I know you really want to help out here. I know you're trying to um, help them. Let's give them a little bit more time. Or let's have you count to 10 before you actually jump in and actually help. So sometimes I think it's just important for them to know, like, I know you're doing this out of care and love, but these are the strategies that really help me. And so that's why I think it's helpful to kind of write down what your strategies are, what you do, what kind of support you do want from the other people, because then there's no question about it. They don't have to guess what to do in the moment. It's kind of like, here are these things. This is what I want you to do before you help me.
Absolutely. Thank you. And I have another question that was asked by Linda, and Linda has asked about auditory processing, kind of the other side of communication, where she says it's difficult for her to comprehend what people say to her when they're talking fast. And she asks them to slow down, but she has a hard time because sometimes people don't continue to speak at a pace that's appropriate for her to understand. And she said that sometimes it happens when she's reading something and it takes her mind a moment to catch up. Do you have any suggestions for how to approach those conversations?
Yeah, I think much to kind of what we've spoken about here is just being an advocate for yourself. And so if you have to ask that person 5 times to please slow down, please give me more time, be an advocate for yourself. And like Anna said, being clear about the supports that help you can help in those situations. Asking people to write down their messages. Sometimes even if you maybe feel stronger with reading than you do with auditory comprehension, um, you know, bringing out speech to text software in a conversation, like most phones have it on a keyboard where you can just click record and it'll start kind of taking notes on what's being said. So you can get that visual information too. And primarily, I encourage people with auditory processing difficulties to try to focus in on key words. There is a lot of what we say in our language that is fluff. And if you can just focus in on words here and there that are really sticking out, sometimes that can kind of reduce that cognitive load of trying to process the entire message and just get those keywords. And if that's something that's helpful for you too, that may even be a strategy for you. Hey, I want you to write down the keywords that you're saying here so that I can really soak in this message.
Absolutely. Thank you. And we have actually had a couple of questions about this. People asking for more information about the expiratory muscle strength trainer and how that can help with speech and swallowing.
Yeah, so that's a great resource. It's something that I used quite a bit in therapy. It is something that I would encourage you talking to your doctor and your speech therapist about. There are some reasons or medical reasons why some people wouldn't do that specific exercise because it involves kind of holding your breath in some sense and doing some effortful exercise. So just like before you would do a physical therapy exercise, you would want to clear that with your doctor first. So I'll say that. Um, a little bit about it. It's a little handheld device that your SLP can show you how to use. And it has proven to have good outcomes as far as helping swallowing muscles get stronger, as well as your cough strength. So um, I don't know that anyone has a perfect swallow, but swallowing problems can certainly be a part of Parkinson's disease. And when things do go down the wrong pipe, you want to have a nice strong cough to expel that thing that's not supposed to be there from your lungs. And so you'll hear speech therapists really sing the praises of EMST because it can really make some huge changes in how people are able to cough up things. So we're all about it. We would just say, with a disclaimer, make sure you chat about that with your doctor and your SLP first.
Thank you. And the next question that we have is from a care partner who has asked for any strategies that help keep the dignity of her person with Parkinson's in mind. She says she doesn't want to nag, but she wants him to be heard. And she wants to know how she can help him remember to turn his face to the listener when he talks, how to remind him to use consonants, etc.
I think this is where those check-ins are helpful. And so checking in with the person that you're trying to help can be really helpful. Like they may not want you to chime in when they're talking with friends, but they may welcome your reminders when they're with family. Um, Generally speaking, I encourage care partners to just try to it's not about being perfect, right? So, like, you don't have to correct it every single time you see it. So, just kind of read the situation, make sure that you're checking in with the person, make sure that they are welcomed for your advice in that situation. And I think this is also really where hand signals can come in handy, because that way you're not calling direct attention to it in a social situation. It's a shared mutual sign that really only means something between you and that person. And if he sees that visual gesture, he has the choice to acknowledge it or to ignore it without disrupting the conversation.
Thank you. And our next question is from a person with Parkinson's. And they've asked, what do you do when you are speaking and then you start stuttering? How can you regroup and continue?
I think that's going to be very different depending on the individual. I've seen different strategies work for different folks. Um, so I want to proceed with caution to say I don't want to give you a suggestion and then be like, well, that didn't work. So I think that there are a lot of strategies you could try. I think if this is something that's increasing in its frequency and you have seen a speech therapist, I would encourage you to go back and reevaluate that, see if the same strategies work or not. But again, like you might notice that those things continue to happen. There's probably even medications and side effects from different treatments, such as like deep brain stimulation, where you might see more of that. So some people have really persistent difficulties with that, and some don't. And so I'd be cautious to make a suggestion without knowing and talking with you.
Yeah, so we had another question actually about stuttering and vocal exercises and techniques to help minimize stuttering. So your suggestion would be that they talk to a speech pathologist who can help them locally.
Yeah, I
Yeah,
would
it's
say
important
it's
to
pretty
understand
common.
where that's coming from. Yeah.
Yeah, great. And you mentioned medication just now. We have one question that asks, can medication help or hinder stuttering, slurring words, and voice issues?
Very dependent on the medication and your medical situation. I'd say that that would be a better conversation to be held with your medical provider or your pharmacist to get a better understanding of the side effects of your specific medication list.
Thank you. And a question from a care partner. Their loved one has Parkinson's with dementia. So they're saying that they're noticing speech issues caused from both the Parkinson's and the dementia. And they've asked, any tips on how they can help facilitate communication with their loved one.
Yeah, I would say it's going to look a little bit different, right? So when somebody has a lot of cognitive challenges, we have to kind of change our expectations, right? And we want it to be enjoyable. We want to really play up on their strengths. We don't want people to be frustrated. There's not a whole lot of purpose in correcting people or reminding them of something that they've forgotten, things like that. So all of those good tips of just like I love the person who's like considering their spouse's dignity and in how they're helping and just kind of thinking about, okay, what can we do together that would be enjoyable? How can I figure out what they want? Sometimes things like those communication aids that are either low tech or high tech are used with support. So I think sometimes people think, well, oh, my loved one couldn't use something like that. But oftentimes it's something that you're going to use together to figure out what they're trying to say and what they want. And some people might need something written or with pictures because of a understanding problem, or it might be a recall problem. I don't remember what was going to say, or I don't remember what the options are for different places we like to go out to eat. But if you provide me with those choices, now I can participate and we can go have a nice lunch together and enjoy ourselves. So I think it really is thinking about those supports and that some people might need more supports than others for different reasons. And so I would just be looking at what can you offer them that allows them to still make a choice and to communicate something to you.
Mhm. And to kind of expand on what Anna was saying earlier about playing on strengths, sometimes with dementia, it can be really helpful to focus on things in the past. So, talking about reminiscence, playing familiar music, looking at old pictures, things like that can really just open the door for that person and just make that communication feel more achievable for them. So it doesn't need to be talking about, what happened yesterday, but maybe looking back at pictures from, when the kids were younger or that one really awesome trip that you took and just sitting and looking at the memory book, playing that old music from the teenage years tends to bring about a lot more clarity. So play to those strengths and center the conversation around things that are still obtainable.
Thank you so much for that thoughtful advice. And that is all the questions that we have time today to address. But really, on behalf of the whole APD audience, Anna, Corinne, we're so grateful for you taking the time to join us today. We're grateful to the wonderful team of speech pathologists from Lingraphica for sharing their expertise with our audience during this series. And if you all have any questions, please feel free to reach out to APDA. Thank you to our expert presenters. Thank you to our audience, and we hope that we will see you at a future APDA program, which is our Dr. Gilbert hosts episode on March 26th about keeping Parkinson's research on track. So again, thank you everyone for being here. I hope you have a wonderful rest of your day. Take care.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity.